November 8th, 2012. In-class note and activity, routes and formulations. We will be looking at the routes and formulations, oral formulations, sublingual and buccal formulations, rectal formulations, and finally vaginal formulations, after which we will do a quiz. The homework list for today is study for the third and final unit test of the semester. It will cover chapters 5, 6, and 7. For chapter 7, it will cover pages 155 to 163 and 180 to 181. You should start working on the problems in your workbook on pages 68 to 77. The learning targets for today, you should be able to say, I can distinguish between enteral and parenteral routes of administration. I should be able to list the dosage forms and routes of administration of medicine to the human body. I should be able to compare and contrast the solid and liquid formulations. I can compare and contrast sublingual and buccal formulations. I can compare and contrast rectal and vaginal formulations. Routes of administration. The way the body absorbs and distributes drugs vary by route and dosage form. You have enteral and parenteral routes. For each route, there are a variety of formulations to deliver the medication. Enteral routes are the red. They include oral, buccal, sublingual, and rectal. Tablets, capsules, bulk, powders, solutions, suspensions, elixirs, syrups, and emulsions are oral. Buccal are tablets and solutions. Sublingual are tablets and lozenges. Rectal, solutions, ointments, and suppositories. Parenteral routes. You have interocular, intranasal, inhalation, intravenous, intramuscular, and intradermal. The dosage forms for interocular are solutions, suspensions, ointments, and inserts. For intranasal, solutions, suspensions, ointments, and gels. For inhalation, solutions, aerosols, and powders. For intravenous, intramuscular, and intradermal, solutions, suspensions, colloids, and emulsions. Parenteral routes include dermal, subcutaneous, and vaginal. For dermal, you have solutions, tinctures, colloids, laburnums, suspensions, ointments, creams, gels, lotions, pastes, plasters, powders, aerosols, and transdermal patches. For subcutaneous, you have solutions, suspensions, emulsions, and implants. And finally, for vaginal, you have solutions, ointments, creams, aerosol foams, powders, suppositories, tablets, and finally IUDs. Oral formulation is the most frequently used route of administration. When formulations are orally administered, they enter the stomach, which is very acidic. Liquid dosage forms reach the circulatory system faster than solid dosage forms. The pH scale measures the acidity or alkalinity of a substance. From 1 to 6.9, it's acidic. 7 is considered neutral. 7.1 to 14 is alkaline. Oral formulations are made up of various parts. The active drug is the biggest part, the biggest blue-red part. Diluent dilutes some of the active ingredient. Disintegrant, lubricant, and binder are the other parts. Oral formulations have disintegration and dissolving of tablets, capsules, powders begin in the stomach and continues in the GI tract. Enteric coating delays this until it reaches the GI tract. Tablets are machine compressed into various sizes, shapes, weights, hardness, thickness, and dissolution rates. Capsules contain the drug inside a variety of sizes of gelatin capsules. This capsule dissolves in the stomach, releasing the powder. You have coated tablets, sustained release or SR, sustained action SA, extended release ER or XR, prolonged action PA, controlled release CR, time release TR, and long-acting LA. You finally have bulk powders, which contain the active ingredient in a small or big foil envelope. It's emptied into a glass of water and juice and drank. Most dissolve in liquid prior to the drinking. Oral formulations continue with solutions, which are clear liquids. The The solute is dissolved in a solvent. Syrups are concentrated solutions of sucrose in water. They are less than 10% alcohol. Non-aqueous solutions include glycerin, alcohol, and propylene glycol. Elixirs, clear, sweetened hydroalcoholic liquids. Spirits or essence are hydroalcohol or alcoholic volatile solutions. Tinctures are hydroalcohol or alcoholic non-volatile solutions. Suspensions, drugs does not completely dissolve in a solvent. It settles over time. Emulsions, oil and water mixture with emulsifying agent. And finally gels, using gelling agents to increase the viscosity. It has a three-dimensional arrangement. Solutions. The advantages: they are completely homogeneous doses, immediately absorbed, easier to swallow, and the dose can be adjusted. Disadvantage: it's less stability. Some drugs not soluble. They may require special additives or techniques to mask bad taste and require a dosing device. Suspensions. Advantages: oral dose of insoluble drugs, easier to swallow, dose can be adjusted, masks some of the bad taste of drugs, and chemically more stable. Disadvantage: it settles out over time and unpleasant oral texture. Sublingual and buccal oral formulations. Mouth is the route of administration when rapid action is desired. Best example are nitroglycerin tablets. You need to wet your mouth before placing tablet under the tongue, although sublingual has limitations. Buccal cavity is inside the cheek. Rectal formulation. Administered rectally for local effect or to avoid oral degradation. Suppository solutions, ointments, or enemas. They have certain significant disadvantages. Vaginal formulations have many of the same characteristics of other parenteral routes of administration. The dosage forms include tablets, ointments, creams, aerosol foams, and suppositories. Finally, you have an intrauterine device, an IUD. It is a contraceptive device placed in the uterus for a long time. The in-class activity. There are 14 different prescriptions. You will choose one to start with and fill out the prescription label below. You will then look up the drug in the PDR at your table to check which auxiliary labels are needed. Choose the correct ones and apply them below the label. Have your instructor check you off and then go to the next prescription. You're going to repeat the process until all 14 are done and turn in your packet to your instructor. You will count out and finish filling the prescription for only the first prescription. This bottle will be saved to document that this activity was done. Steps in counting medication. Choose the correct medication to dispense. Pour out the medication onto the counting tray. Using the spatula, count out by fives. Count out the last few as needed. Pour into the correctly sized vial and place the safety cap on. Attach a label and auxiliary labels as needed. Hand it to the pharmacist to be checked. You will be filling for two possible patients, Mark Strymer or Emily Snow. You will be taking a 20-point quiz. And finally, the learning targets are: I can distinguish between enteral and parenteral routes of administration. List the dosage forms and routes of administration of medicine to the human body. Compare and contrast solid and liquid formulations. Compare and contrast sublingual and buccal formulations. Compare and contrast rectal and vaginal formulations.